I will call Dr. Rupali Jain, madam, for her first talk, how to set up allergy clinic.
Okay, thank you, chairpersons. We all know that allergy is affecting 25 to 40% of the population worldwide, but allergic rhinitis is the most common of all the allergies. And we have very few trained allergy specialists, so definitely learning allergy testing and immunotherapy is a must now. And these allergy patients, they will have tried everything from the OTC medicines to homeopathy, Ayurvedic, even acupressure to relieve their symptoms. So it is necessary for an ENT surgeon to know about the various allergy diagnostic tests and immunotherapy preparation and dispensing. Now, how to get a proper training in allergy diagnosis and immunotherapy? There are a lot of courses which have been started by our own ENT surgeons, and you can get yourself trained there. What is the basic requirements to start an allergy clinic? First, you require a comfortable professional setup, well-trained assistants. There are now courses even for assistants, proper documentation. I will elaborate on the documents, the examination instruments which we all have, the reliable antigens for the diagnosis, educational materials and emergency cards. There should be a proper consultation room and a preparation room for endoscopy and skin prick test, which will have a comfortable temperature, good light for proper visibility of the skin to record the results of the skin prick test. And an immunotherapy preparation room, which should be again a sterile room, so that the allergens do not get contaminated. Documentation, as we all know, for medico-legal purposes also, it's very important, and even for our research purpose. Questionnaires there are questionnaires which have been prepared for history taking. If you do a proper training, you'll get the questionnaires from the course conductors. Then the endoscopy and the examination findings should be documented. Consent forms are mandatory for skin prick test. The case sheet to record the results, and keep all the documents with you. They help us in the research work, the planning the lines of treatment, and legal issues if they arise. Now, this is a pro forma of my allergy testing report, where after doing the allergy testing, where I write the allergens, how much is the wheal and the erythema size, and the remarks. The educational materials are very important, because we have seen that when we tell the patients a proper, even the nasal spray, sometimes our staff, they explain to the patient, but the patient, they do not take it in the proper way. So all the pamphlets with images, the nasal drop, nasal sprays and inhalers to explain the correct method of use. And even the slit bottles, because sometimes, because the dose, it should be a sublingual dose. The patients, they tend to take it orally, and so they may not get the results. So these educational material are very important. Even the avoidance measures pamphlets. Now, for doing this skin prick test, a proper examination room is desirable. A desk and a table if you are doing on arms, and if you are doing on the back, then should be a couch. Good quality allergen extracts, apron to cover the chest and the abdomen, especially in females, so that only the hand and the back is exposed. The spirit swab, normal saline, the lancets. Now we get 1 mm and 3 mm lancets, timers after to record the results. The measuring scales, and a refrigerator is must to keep the allergen kit as well as the immunotherapy. Now here, this is the procedure. The female patient, she has worn an apron, and the hands, they should be kept comfortably on the table. This is the allergen testing kit. You will find that these bottles, they are colored bottles. Colored bottles for like dust mites, pollens, fungi, food allergens. These are the lancet. This is a 1 mm lancet. This is how we do it. You must have already seen in the demonstration. And these are the scales for measuring the results. Emergency card, though anaphylactic reactions are very, they are not much reported, but sometimes even a patient can go in vasovagal attack. So it's mandatory to keep up this emergency card, the pulse oximeter and the BP apparatus, adrenaline injection, steroids, antihistamines, aminophylline, oxygen cylinders, and ambu bag. Now, while preparing the immunotherapy, try to see that whatever kit you are using for the allergen testing, the immunotherapy should be of the same company. When you mix the place where you are mixing the immunotherapy, it should be a well ventilated and a clean room, free from any distractions. You have to follow the basic sterility precautions. There should be a prescription for whenever you order for the immunotherapy, there should be a prescription. The stock bottles, the dispensing bottles and the diluents, then your staff should be well educated, and this immunotherapy should be kept refrigerated at 4 to 8 degrees Celsius. Now, whether you are giving a sublingual immunotherapy or a subcutaneous immunotherapy, you should take care of this. You have to take an informed consent, again for slit or skit. Like the informed consent, it should maintain how much duration the patient has to follow, the risks of taking this immunotherapy, and it should be in a proper schedule. Then the dosage schedule form is very important because we are going to give it in doses. So it should be in a writing form, because when you are giving a skit, the patient might get it injected in some other hospital. So the other general physician, he should know what is the schedule which he has to follow. Then there should be a waiting room for at least 30 minutes after giving a skit or even on a slit. Ask the patient to sit for at least 30 minutes. Then the form, there should be a form should be given to the patient if sometimes if the patient might explain an anaphylactic reaction, so what the measures they have to take. The contact number of your hospital in case of emergency. The compliance is very poor in AIT because mainly it's due to financial reasons. So always try to take the contact number of the patient. So once you know that the patient is going to finish his dose, you can call them and ask them to get order for the next dose. If you are doing, apart from allergic rhinitis, you are doing asthma, you should have a spirometry and oscillometry. If you are seeing skin allergy, is a patch testing kit. And food allergy, you need food or oral food challenges. So if you have any doubts regarding doing allergy training courses or starting an allergy clinic for informed consent forms or questionnaires, you can contact me on these numbers. Thank you.